Do you feel like you can feel a medication going down your esophagus? Or maybe you feel your heart beating in your ears every time you're nervous. Or on the other hand, maybe you have a really high pain threshold, or you completely forget to eat or go to the bathroom. If any of these are the case, then you might have an interoceptive sensitivity. My name is Dr. Ruth Dutton. I'm a board certified adult psychiatrist, and I'm going through a series where I go through each of the 8 different sensory sensitivities and how they can present in different people and what we can do about it. Today is the last sensory sensitivity, and that's that of interoception. And interoception is your ability to notice and interpret different internal body signals, things like pain, heart rate, breathing. Now, it's important to note that someone could either have heightened or lowered sensory sensitivities to interoception, or they can have a combination of both. Those with heightened interoceptive sensitivity are hyper aware of what's going on in their body. They might be more likely to somaticize or get physical symptoms when they're experiencing strong emotions. So they might get a headache or feel dizzy or have a stomach ache if they're upset. They can feel their pulse throughout their body, and they're exquisitely sensitive to when they're feeling hungry or they have to go to the bathroom. And they tend to have a low pain tolerance. Now, anxiety can be a significant issue for these individuals, especially between that correlation between their internal body cues and how that can change when they're feeling anxious. So it can be really helpful to have some good mindfulness practices to help bring them down from that fight or flight mode and back into rest and digest mode. And they may also need a lot of reassurance that these experiences that they're having are not necessarily pathologic. They can just be normal body functioning. Those with lowered interoceptive sensitivity don't tend to be aware of what's going on in their body. They completely forget to eat or go to the bathroom all day. They tend to have a high pain tolerance. So we classically see this in autistic moms who go through childbirth with minimal pain. And these individuals will just go until they crash because they can't really tell that they're tired. They may need an external reminder of what their body needs. So it can be helpful to set an alarm for meal times or times to go to the bathroom regularly throughout the day. It's also important that healthcare providers be aware if they have a high pain threshold, because it may seem that there's nothing serious going on because of how the patient presents, but there could be some serious pathology that the patient is not aware of or not expressing. What about you? Are there other ways in which you've experienced sensory sensitivities to interoception? Please share in the comments below. I'd love to hear about it.